Hello, this is Dr. Mukhtar Yerima. Today I'm going to talk about another important sleep condition that is called insomnia. Insomnia is very important because it affects a very large proportion of especially the adult population globally. In fact, it is so common that up to about 30% of adults globally have had one or more of the manifestations of insomnia. So, what is insomnia? So, essentially, insomnia is a condition in which an individual who suffers from it tend to have a complaint of recurrent difficulty initiating sleep or recurrent difficulty maintaining sleep, in which the person tends to wake up often, more than once in a night. In fact, difficulty maintaining sleep can sometimes be considered as waking up more than 3 times in a night. Or in some people, insomnia presents with waking up very early, much earlier than their usual time. Whereas in other people, insomnia manifests as a non restorative or a non refreshing sleep. So essentially, this is what insomnia is. But in some categories of people, insomnia can be so severe that it can become a condition that is called insomnia disorder. So it can be disordered in some categories of people, and these are the criteria that, when they are fulfilled, can be called, or the insomnia can be called insomnia disorder. We're going to go through that, but first let's look at insomnia generally, because like we said, in this percentage, like we said, up to about 30% of adults can have insomnia, and in this proportion of people, most of them actually do not meet the criteria that will make them be deemed to have insomnia disorder. But nonetheless, they have insomnia, which means they have difficulty with sleep, which means they have difficulty either initiating sleep or maintaining sleep, or they wake up much earlier, and then the sleep is somehow non-restorative or non-refreshing. So, which means it is nonetheless a condition that would require some medical attention. So, what are the things that we need to do if we come across, or what are the things that we usually do when we come across people who have insomnia? Usually, the first thing we do is to do what we call, or is to take what we call sleep history. Now, in the sleep history, we look at a number of things, but importantly, we start with what we call the timing of the sleep difficulty. So, just like I said, the timing of the sleep difficulty varies for different people. In some people, it is that the timing will be that it is mainly difficulty initiating sleep, which means when they go to bed, they will lie on the bed and they spend a lot of time turning and tossing around on the bed without being able to initiate sleep. If this happens for longer than usually 30 minutes, it might be considered that really this person has difficulty initiating sleep. So from the time that you have finally decided to go to bed and to start sleeping, and you lie down in bed and you are expecting sleep to come, and you spend more than 30 minutes without sleep catching up with you, or without being able to initiate sleep, then really the timing of your sleep disorder can be considered to be an initiation. And at times it is also called initial insomnia, which means it is the initial phase of the sleep that is disordered in this kind of people. In some other people, the difficulty with the sleep, or the timing of the sleep disorder, is mid insomnia, which means they are able to initiate the sleep at the beginning, but then maintaining the sleep becomes an issue. So they tend to wake up often, usually more than 3 times in a night. So essentially, this means that they are unable to maintain their sleep. So that is the so-called mid insomnia. Whereas in other categories of people, the timing of the sleep difficulty is towards the end of the night, which means that they have no difficulty initiating sleep, and they are somehow able to maintain the sleep, but they tend to wake up much earlier than usual. So these are people who have early morning awakening, and they are said to have what we call terminal insomnia. So these terminal, initial, or mid insomnia are just descriptive terms to show the timing at which the person has these sleep difficulties. This timing is very important to know, because it will help in knowing what sort of interventions can be given, and also probably give away the possible cause of their insomnia, especially if their insomnia becomes insomnia disorder. So that's one thing we do. The next thing we usually do is to look at the schedule of the sleep. Usually, people should have a regular sleep schedule for them to have a normal and sound sleep, which means you should go to bed at exact or equal times daily, and you wake up from bed at exact and equal times regularly. So if you are the type that goes to bed by 10 o'clock in the evening and you wake up 6 or 7 o'clock in the morning and you do that regularly, then the schedule of your sleep is considered regular. Whereas in other people who maybe this night they go to bed 8 o'clock, tomorrow they go to bed 10 o'clock, next tomorrow they go to bed at 1 a.m. So that makes it a kind of an irregular schedule, and that categories of people or that category of people are more likely to have sleep disturbances, and that's why knowing the schedule of the sleep in sleep history is very important, and we tend to look at that. Another thing we look at is whether there are other sleep disorders. So there are some other sleep disorders that actually result in people having insomnia. So one particular sleep disorder that can result in insomnia is what we call obstructive sleep apnea. Obstructive sleep apnea is a type of sleep disorder that we might perhaps discuss in subsequent videos, but it is a disorder in which the person has apnea, which is difficulty in breathing or kind of inability to actually breathe in a certain period of time during sleep. It is obstructive because what is causing the obstruction is something to do with the airway, especially the upper airway. So those kind of people are more likely to be seen to be snoring in the night when they sleep, and then those kind of people sometimes might be witnessed by maybe their spouse to be having some apneic spells, which means they might be seen gasping or something in the night. And then this is a condition that is more likely seen in people who have very fat necks, and especially if they are short and they are obese and all those. So this is a particular sleep disorder that if it is there, it can also result in insomnia overall. And therefore, when patients have insomnia in their sleep history, we try to establish whether they have other sleep disorders such as obstructive sleep apnea. Another type of sleep disorder that might also be responsible for insomnia, which we look out for, is restless leg syndrome. Restless leg syndrome is also another condition in which the person has a kind of an irresistible urge to move their legs, especially when they go to bed, especially during the night when they want to sleep. So we look out for these conditions in evaluating a patient who has a sleep disorder. Additionally, we look at whether this sleep difficulty, whether the insomnia the patient is having is resulting in any daytime consequences. This is for us to know, because if there is a sleep difficulty and the person does not seem to have any daytime difficulties, then perhaps it is just a misperception, and that's why there is another type of sleep disorder that is called paradoxical insomnia, in which although the person is sleeping very normally, but somehow in the morning they tend to think as if they do not sleep adequately. But if there is really insomnia, then in most cases it tends to result in some daytime effects. So these daytime consequences or effects will include maybe tiredness and lack of energy. The person will just feel that he doesn't have energy to do anything. He will feel fatigued. Another consequence is that the person might be irritable, which means any small frustrations make them very angry. Sometimes also the consequences might include poor concentration, and in other people they might be unable to become as productive as they used to be. So productivity or work performance becomes significantly reduced. So these are the kind of daytime consequences or effects that we're looking out for when we assess people for insomnia. Now, but what are the causes of insomnia generally? Now insomnia can be caused by a number of things, by a number of factors. One of them is if there are medical conditions. So any medical condition, especially chronic medical conditions, and especially or particularly medical conditions that are likely to result in painful distress. So people who have chronic osteoarthritis, in which, or maybe they have chronic or rheumatoid arthritis, in which there are pains at many places, or they have some certain neurological conditions, or in some certain medical conditions that results in difficulty in breathing. So somebody who has heart failure, for instance, you know that breathing might be an issue, especially when they lie down flat. And that's why there is a symptom of heart failure that is called autopnea, which means if they lie down flat, they tend to have difficulty breathing, and oftentimes you see themselves prodding themselves up with a heap of pillows. So medical conditions like that usually can result in insomnia, and that's why another thing we do is when a patient comes with difficulty in sleep, we usually go to town. We actually extensively evaluate for medical conditions, in fact, including some laboratory tests, including general physical examination of the person, to make sure that it is not a medical condition that is resulting in this difficulty in sleep that they are having. The other causes of insomnia include psychological illnesses. So a number of psychological conditions can result in insomnia, but prominent among them include anxiety disorders and depression. In our previous videos on anxiety disorders, especially generalized anxiety disorder, we've talked about the fact that insomnia is likely to occur. And in fact, insomnia is a key symptom of generalized anxiety disorder. So, but in any case, anxiety disorders can result in insomnia, and particularly the initial insomnia that we talked about when I was talking about the timing of the difficulty initiating the sleep. So, that initial insomnia is more likely to occur in people who have anxiety disorders. Now, depression also tends to result in difficulty with sleep, insomnia, and particularly if the difficulty with sleep occurs towards the end of the night. So in depression, the insomnia is more likely to be terminal insomnia, which is described as waking up much earlier than their usual waking up period. So these are some of the psychological conditions, but a number of other psychological conditions can result in insomnia. Overall, there are a number of psychological conditions that can result in insomnia, but particularly anxiety and depression. Another cause of insomnia that we look out for is psychosocial stressors. Now, psychosocial stressors are situations in which the person has some current life difficulties, or maybe there are some current life changes. So, somebody who has changed a job and who has moved from one city to another and has moved to a new house, it's not unusual for them to have difficulty with sleep, especially in the first initial few days that they are trying to get acclimatized to the new environment. So it's usual for that to be seen. Also, people who are bereaved are likely to have some form of insomnia, or people who are going some other forms of life difficulties. Maybe they are divorced or they are going some forms of difficulties. They're likely to have sleep disorders. Also, people who have some certain habits. So when we assess for people who have insomnia, we check for the use of some certain substances. So use of alcoholic beverages or use of tobacco or use of caffeinated drinks or beverages, all those habits tend to result in people having a higher tendency for them to report insomnia than other people who do not have these habits. So some medications also are likely to make the person who takes them have difficulty falling asleep. So medications that are likely to have some stimulant effects. So stimulants generally, whether they are prescribed stimulants or they are over-the-counter stimulants, can affect sleep. Then some forms of antihypertensives, especially beta blockers like propranolol, can potentially affect the sleep. Other medications such as clonidine are also found to affect sleep. Theophylline can also affect sleep. Now, another cause include family history, or another thing that can explain why some people have insomnia is if they have a family history of insomnia. And that is important because there is a certain type of insomnia that is called fetal familial insomnia, which is one very serious type of sleep disorder or insomnia, and it tends to be heritable. So again, we tend to assess if there are family members who have this kind of sleep disorder that this patient or that this individual is having. And we try to do that by asking, especially if a first degree relative has this kind of sleep disorders. So these are the causes of insomnia, but there are times when it is not just insomnia, which means it is not just a symptom, it is now a disorder. Now, when is it considered a disorder? Is that if there is recurrent difficulty or in which the person is unable to fall asleep, or the person is having difficulty staying asleep, or the person is otherwise having a non-restorative or a non-refreshing sleep, the person experiences these symptoms despite having adequate opportunity for sleep. And also, they tend to have a daytime effect. So for it to be considered an insomnia disorder, there are usually what we call daytime effects, and we've mentioned these daytime effects here, like such as a situation in which the person feels tired in the day, or he's irritable, or he loses concentration, or his work productivity reduces drastically. Now, so in addition to all this, there's enough opportunity, but despite that, the person has difficulty sleeping, and then it results in daytime effects. And then this occurs at least 3 times per week, and it has lasted at least for 1 month. Now, if this is there and this condition or this manifestation cannot be explained by another sleep condition, because there are times when what is causing all this is because they have another sleep condition. So for it to be called a disorder, then all this cannot be explained by another sleep condition. Number 2, it is not also going to become explained solely by a mental or a medical condition, and it is not the physiologic effects of substances or medications. So if this is, or if these are fulfilled, then we can now say this individual has insomnia disorder. Insomnia disorder meaning that it is a primary sleep disorder, which means it is not accounted for by anything, and it is significant enough because it is affecting his life, it is causing him distress, it is generally causing a lot of issues in his life, and that's why it is called insomnia disorder. So if that is the case, or if there is insomnia, what do we do? Now, what to do is to do a number of things, including some treatments. But before we look at treatments, there are some things that can be done. And usually, let me start from sleep diary. Ideally, doctors or people who are in sleep centers or in hospitals generally would want to know a lot of things about the person, so that most of these things we've said, whether there are any medical conditions, or that the person is taking any medications, what time does he go to bed, what time does he wake up, what are the things that he uses, does he use alcohol, caffeinated drinks, tobacco, and all those things. It is when you give him to keep a sleep diary, or when you ask the patient to keep a sleep diary, that you are able to understand all these things, and that you are even able to help the person significantly. So part of the treatment, in addition to the assessment that we say we are going to do, including taking the sleep history, we usually actually keep a sleep diary. So the person is asked to keep a sleep diary, and he is instructed on how to go about recording some of the things in the sleep diary. And ideally, the person should keep this sleep diary for a minimum of like about 2 weeks, and or even longer, but minimum of 2 weeks. And when the person keeps a sleep diary for that minimum period, it gives a very good picture of his sleep pattern and the factors that might probably be responsible for the sleep pattern that he has. Now, when that is done and we understand the condition and whether it is insomnia and it is not maybe insomnia disorder, then there are a number of things that we can do, including what we call sleep hygiene. So, sleep hygiene is a simple kind of advice that we give to patients who have sleep problems, and they include things that we ask them to do. So, there are do's. So, there are a number of do's in sleep hygiene, and there are a number of don'ts of sleep hygiene. So, for instance, one of the do's is that the person should make sure that the sleep environment is comfortable and it is cozy. So that means the temperature should be comfortable. So if it is during the cold season, the temperature in the room should be controlled in such a way that it is not too cold. And if the season is hot, as in summer or the hot season, the temperature should be also be controlled so that it is not too hot. Now, noise should be controlled for, and lighting should also be controlled for, so that there shouldn't be too much noise and there shouldn't be too much light in the sleep environment. So this is a very important thing that patients are asked to do in the sleep environment, and it is one of the components of the do's in sleep hygiene. Another important thing that we ask people to do in sleep hygiene is to unwind, which means just before bedtime, you should not just maybe leave work and you're still excited from some thoughts to do with work, or you maybe some activities that you've done in the day, and you just go and lie down straight to bed. No, no, no. One of the things you should do is to unwind, which is to try to relax. Have some time to relax, to maybe declutter your mind before you now move to bed. So that is unwinding, and that is also one of the do's of sleep hygiene. Another thing is to encourage people to have regular exercise. So regular exercise is one of the do's of sleep hygiene, and it is found to significantly improve sleep in people who have insomnia. So, but we're going to mention in the don'ts that people should not take late night exercises, because again, if you take exercise late in the night, there's a tendency that you might feel pumped up, you might feel stimulated, and instead of you to feel like going to bed, you will now rather feel like doing something else. So whereas regular exercise is encouraged in general principle as one of the things that should be done in sleep hygiene, but it should not be done late at night. So late night exercise or late evening exercise generally should not be encouraged. Another thing that should be done is regular sleep schedule. Remember earlier we said the sleep schedule should not be irregular. You should have a regular sleep schedule in which you know the exact time that you want to go to bed, and you know the exact time that you want to wake up, and you keep to that schedule daily without changing it as much as possible. Of course, there are times when maybe circumstances or some other exigencies will warrant that you do not keep that schedule, but as much as possible, we encourage in sleep hygiene for people to have a regular sleep schedule. So the don'ts include avoiding large meals at bedtime or late in the evening. So as much as possible, people should not take large meals at bedtime or in the late in the evening, because that tends to disrupt sleep. That might result in indigestion, that might result in so many uncomfortable situations. And remember that one of the medical conditions, here we talked about medical conditions that can be responsible for causing insomnia. One of them include gastroesophageal reflux disease, GERD. If you go to bed with a large or with a full stomach, there's a tendency that your reflux might probably be worsened, and that is likely to further worsen your sleep. In addition to the fact that the large meals generally can be discomforting when taken late in the evening. So large meals, as much as possible, should be avoided. Also, reading or watching TV in bed should be discouraged significantly. And there is one maxim in sleep hygiene that bed should be reserved for only two things: for sleep and maybe for some intimacy with one's spouse. So apart from sleeping or intimacy with one's spouse, then bed should not be used for any other thing. So some people read in bed, some people watch TV in bed. That is a discouraged behavior, especially for people who have insomnia, and it should be discouraged. Also, taking coffee in the evening. Now, not just coffee, tea, other caffeinated drinks, anything that tends to, smoking cigarette, taking alcohol, anything that when it is taken, it tends to stimulate the individual. That those things should not be done or should not be taken late in the evening. And of course, in addition to avoiding late night exercises, like I said previously. So this is by and large what sleep hygiene is all about. So usually most people, a very large proportion of this 30% of people, of adults who have insomnia, when they are given education on sleep hygiene, their sleep problem tends to improve significantly. Since, like I said, in most cases, their condition is actually not as bad as to be termed an insomnia disorder. What they have is an insomnia, and perhaps it is transient, maybe because they are going through some life changes. Like I said, maybe they are going through some psychosocial stressors. So if they are given this sleep hygiene, it is found to improve their sleep significantly. But other things, there are other approaches in addition to sleep hygiene that can be done. They include what we call cognitive behavioral therapy. Cognitive behavioral therapy has been found to be significantly important, and it has one of the largest evidence base for many mental and behavioral disorders. So there are ways in which cognitive behavioral therapy can also be employed in the treatment of sleep disorders, especially insomnia and insomnia disorders. Then medications. Now, in some proportions of patients who have insomnia, medications might be used. There are a number of medications that have been found to be important and to be useful in the management of insomnia. Different classes of medications. Some of them can be gotten over the counter, whereas others can only be gotten by prescription. So it is important to note that medications might be given in some categories of patients to help with the sleep disorder that they have. So by and large, this is insomnia. And like I said, there are people who have insomnia disorder, and these are some of the causes of insomnia generally. And in some patients, the insomnia tends to be persistent, and it tends to be present, and it affects their daily life and daily activities, and it is not better accounted for by other medical conditions or other conditions going on, and that is when it can be called insomnia disorder. That's it for today. Thank you for listening.